Sickle cell disease is very common. At least you know somebody or have someone that knows someone that has sickle cell disease. On today's episode of nutrition-related health conditions, our S is for sickle cell disease. Sickle cell disease is an inherited blood disorder that causes the body to produce abnormal hemoglobin. Now, hemoglobin is that part of your red blood cells that help to move oxygen to every part of your body. Healthy red blood cells are round and move easily through your blood vessels. But in sickle cell patients, due to abnormal hemoglobin, the blood cells are shaped like letter C. This has three implications. One, due to the abnormal hemoglobin, the red blood cells can't carry oxygen efficiently to all parts of the body. This leads to tiredness, shortness of breath, and other symptoms of anemia. Also, healthy red blood cells can live up to like 90 to 120 days. But in sickle cell patients, the sickle cells are fragile and have a much shorter lifespan, like 10 to 20 days. This further worsens anemia and inflammation. Two, because the blood cells don't move freely in the blood vessels and are also sticky, they clump together and may block blood vessels, restricting blood flow to various organs of the body. This is the reason for the frequent pain crisis. Three, insufficient or lack of blood flow to vital organs, including the spleen. This can cause damage and can result in frequent infections or multiple organ failure. Now, nutrition can significantly improve the quality of life of sickle cell patients by addressing the challenges at all these stages. So here are a few general tips. One, unlike the rest of us that need 2 to 3 liters of water, patients with sickle cell anemia need 4 to 5 liters of water daily. This helps to prevent the clumping of red blood cells, which means fewer crises. Two, while most of us need 2 to 3 servings of fruits per day, sickle cell patients need 5 servings of fruits. This is to combat the level of inflammation that is going on in the body and protect the body's cells and tissues. Of course, healthy fats, vitamin D, zinc, and selenium also play a role in reducing inflammation and boosting immune health. Three, sickle cell patients need a lot of energy and protein to produce new blood cells due to the short lifespan of red blood cells, which put them at risk of malnutrition. If you know someone with sickle cell disease who is struggling to gain weight with low appetite, recurrent infection, or other complications of sickle cell disease, it's time to tell them to consult a dietitian for personalized dietary management as part of their medical treatments. Share this with someone.